morning, everybody. Welcome to this session on Flavours. We appreciate you coming to this workshop. I'm Ian Fear, and I'm going to be hosting this session. I'll introduce the speakers in a moment. Could I have the introductory slide deck put up, please? Thank you. So I'll introduce the panelists, as I say, in a few moments. I was looking this morning, between us, we have a century of collective experience in tobacco harm reduction. So it is a once-in-a-lifetime opportunity to quiz these experts. I'll talk about why we're here, what this workshop's all about, and then my speakers will each give a presentation, 10 or 15 minutes or so, and then we'll have an audience participation, a moderated Q&A session before we wrap up for lunch. So the panelists, we have Elizabeth. I'll introduce them in a bit more detail in a moment. Elizabeth, Christopher, Autumn, and Piot. As I said, I'm Ian Fear, and I've been working in harm reduction, tobacco harm reduction for 17 years. I run a consulting company providing science and research support to tobacco companies, nicotine companies, drug manufacturers, and CROs. Just in terms of disclosure, I am a scientific advisory board member with QNovia, who are a medtech company looking at getting an e-cigarette as a prescription medication. And I'm also a non-executive director and board member with Advanced Inhalation Rituals. Christopher is director of Russell Burnett Research and Consultancy. He's a research psychologist, 15 years working on tobacco and nicotine products, primarily on behavioral studies, behavioral science, and he leads and runs perception and behavioral studies of non-combustible tobacco and nicotine products to help manufacturers submit regulatory applications. Elizabeth works for Altria Client Services in Richmond, Virginia. She leads a team of scientists who also conduct perceptions and behavior studies in support of product applications and regulatory submissions. Before working in regulatory affairs, she led Altria's corporate responsibility efforts and has 20 years of experience in tobacco across research, communications, innovation, and corporate responsibility. Autumn Bernal has 20 years of experience as a toxicologist, provides consulting support, toxicology support in the tobacco harm reduction space. She's the founder of Tox Creative, which supports tobacco companies, nicotine companies, med device manufacturers, drug companies, and CROs. And she specializes in the human health risk assessment of innovative new products. And has global experience, North America, UK, Europe, Australia, New Zealand, and Asia. And then last but by no means least, Piot Kasarovich, 25 years, he works for Philip Morris International, 25 years of experience in regulatory affairs, 9 of those years spent in the tobacco industry working with smoke-free products. He's a pharmacist from the Medical University of Warsaw. He's actually come home to come to this conference. He spent 11 years with the European Medicines Agency, and he's a believer and keen advocate, as we all are, I think, of tobacco harm reduction, and supports the ambition of delivering a smoke-free future. So why are we here, and what is this all about? It's about flavors, and flavors are ubiquitous. This is an image I just found on Google. It's a vape store somewhere in the United States, and it just shows the variety of flavored vaping products which are available. And I think one noticeable thing about this, you probably can't quite see it, but there's only one tobacco flavored product amongst all of these products. And there obviously has to be a reason for that, and I think that's what we're going to talk about today. What is the reason why we have these flavored vaping products? What do they do? What are the pros and cons of these flavored vaping products? And we're also going to focus on tobacco harm reduction. I've taken this from the Imperial Brands website, and it's an equation which describes how you determine population level tobacco harm reduction. So obviously To support tobacco harm reduction, you need a reduced risk product, an electronic cigarette, a heated tobacco product, a nicotine pouch, etc. And then there are two kind of almost conflicting factors which contribute to determining whether a product supports or opposes tobacco harm reduction. And these are what we colloquially call the off-ramp. So this is whether a product appeals to adult smokers and whether it's used by adult smokers. And opposing this is use of these products by non-users, nicotine non-users, and the appeal to nicotine non-users. And we call this sometimes the on-ramp into nicotine use. So again, we're going to touch on these factors today, talking about the on-ramp and the off-ramp, and overall talking about tobacco harm reduction. So there are various arguments about flavours. On the negative side, they're suggested to promote youth appeal and use by youth. They're suggested to make tobacco and nicotine products more palatable for a vapor product. They're suggested to make the inhalation easier, more smoother, etc. There are concerns around addictiveness of flavours. Flavours are suggested to promote addictiveness. And there are toxicological concerns. Not all flavours are safe for inhalation, so there are some toxicological concerns. On the positive side, flavours are proposed to support switching away from more harmful forms of tobacco use, such as cigarette smoking, and certainly Chris and Elizabeth will talk in a lot more detail about this switching factor. The flavours are appealing to adult smokers. Yes, youth, kids like flavours, but so do adult smokers. That's why the vape shops are full of all those flavours, because people want to buy them. Addictiveness is a good thing, and I'll talk very briefly about that in a moment. And Autumn will talk about risk assessment. Proper risk assessment can mitigate the risk of flavour ingredients in novel tobacco products. On this benefit of addictiveness thing that I just mentioned, I've taken this from a paper by Mary Gates, who works at the University of Minnesota, and Dorothy Hatsukami's group. And in this paper, they said that flavour varieties associated with a higher abuse potential and appeal of e-cigarettes. And by abuse potential, what they really mean is the potential of that product to induce dependence on its use or its addictiveness. So higher addictiveness products may help facilitate complete switching from cigarettes to e-cigarettes. And if you regulate flavours aimed at stopping non-users of nicotine from initiating nicotine use with a flavoured product, you have an inadvertent decrease in the uptake and switching amongst adult smokers. So you target one population, your impact is actually on a different population, and probably those who need the most support, the smokers who you need to convince to stop smoking. And this reduces the harm reduction potential, and therefore regulation should be evidence-based, and importantly, you should consider the adult smoker. You can't just look at one segment of the population, you need to look at the population as a whole and include adult smokers and adult smokers' needs in regulation. And Piotr will talk about effective regulation of flavours later on. So there is calls for regulating flavours across the world. I've just taken this newspaper article from a UK newspaper, The Guardian, a couple of years ago, I think, that the UK government is planning to limit flavours. And the motive is always to stop children getting hooked. But as said just a moment ago, the impact is on the adult smoker as well, and we really have to think about that. There is, of course, a new kid on the block in tobacco harm reduction, and this is the nicotine pouch, which, its use is becoming increasingly prevalent in all of those countries in which it's marketed. I think in the United States in the last 3 years, the use of nicotine pouches has quadrupled, so it's on a really rapid rise. And again, these products come in a variety of flavours. There's mint flavours, citrus flavours, apple flavours, a whole host of different flavours. But what we're seeing is the same arguments being put forward about we need to ban these, we need to restrict them. Youth use is often cited as a reason for banning flavoured nicotine pouches. But we also, as I keep saying, we also have to think about those who we want to be using these products, the adult smoker. The environment may be changing, and I think this was one of the reasons that Jess wanted us to talk about flavours, is that there might be a changing of the environment. In the United States, the Food and Drug Administration last year authorised 4 menthol-flavoured electronic cigarettes, taking into account the health of the population as a whole. And then earlier this year, the FDA further authorised ZYN nicotine pouches. Again, taking into account all of the evidence on these products helping to convert smokers, not being appealing to youth, etc., and considering the population as a whole. Recently, though, the World Health Organization has increased its calls for banning flavoured tobacco products. And again, it's utilising the kids' issue. It's maybe not considering the adult smokers' needs for a safer alternative to their combustible cigarettes. I'm also not sure why they've got kids holding up pictures of Juul pods, but that's something only they can answer. So what do we need to think about? And this is where our speakers come in. Do flavoured tobacco and nicotine products support tobacco harm reduction? Do they promote switching? Do they promote abstinence? Can the risks of unintended use be mitigated by age verification procedures at point of purchase or on-device technology which stops kids from using these products? Can the toxicological risk be minimized for flavoured vaping products, nicotine pouches? And finally, how should regulators regulate? What should they do? What should they consider when they're thinking of setting regulation of flavoured tobacco and nicotine products? So I'm going to stop there. I'm going to turn it over to, as I say, each of the speakers will give a short presentation on their views on flavours, and then we'll turn into a Q&A session for some audience participation. So first up, Elizabeth, thank you.
Awesome. Thank you, Ian. All right. I appreciate the opportunity to be here. This is my first time at GFN, so I'm very excited. I unfortunately am not quite tall enough to see my slides that are down there, so I apologize if you see me turning to the side to make sure that I'm on the right one. So I'm going to go into this journey of flavors and why it really does matter to adults who smoke. So I'm going to touch on 3 different topic areas. The first is really the landscape in the US. What are we seeing in the marketplace? From there, I will shift to how flavors can support the journey for adults who smoke to switching to smoke-free products. And then lastly, I'll speak a little bit to the trends of underage use in the US. All right, so what are we seeing? So this is data from our adult tobacco tracker study. So in the United States, we see flavors preferred across various tobacco product platforms. But what's most striking are the data for those who use e-vapor or nicotine pouches. What you can see is that close to 90% of those consumers prefer using flavors. And if we dig into e-vapor, I'm going to show you 2 figures here. The first represents those who use pod-based systems. And so this is data from 2016 to 2024. And what it shows are the number of consumers who use these products, and the blue represents those who use flavors most often, and the brown are those who use tobacco. And across the years, you can see that the preference has been for flavored products. What's interesting is that between 2019 and 2020, flavored pods were banned in the US, but you still see the blue. Consumers want these products and they're finding ways to get them. Oh, sorry about that. See, it's not quite tall enough. Okay, so if we shift elsewhere in the marketplace, what else happened around that time? It was the emergence of disposable products. And so you see the growth there from 2020 to current day. And again, flavors are dominating this, this product. Close to 13 million consumers use disposable products today, and the vast majority of them are using flavors. And so what do those flavors look like? So if we look at the 12.2 million consumers, they're gravitating to fruit, but you see other varieties represented here as well, from menthol down to things like coffee or chai. So this is just a picture, a very quick snapshot of what we see in the US. But now what I want to shift to is what these products mean to adults who smoke and their journey. So I'm going to share with you data from 3 different studies across 3 different product platforms. The first is going to be Enjoy. So I'm sharing with you data for Enjoy, which is an e-vapor pod-based product, and it was available in 4 different varieties. So classic tobacco, menthol, blueberry, and watermelon. And for the purposes of the PMTA, so authorization of this product through the FDA, Enjoy conducted an in-market longitudinal cohort study. And the data that I share here is from month 3. So at month 3, among those who initially used tobacco, you see that about 17% switched completely to Enjoy at the 3-month time point. Now what's important is the values for flavor. You see that flavors essentially outperform tobacco. There are higher switching rates across menthol, blueberry, and watermelon as it compares to tobacco. So this is looking at everyone at the 3-month time point. If we shift a little bit and just focus on those individuals who switched, what we see is the vast majority of those individuals initially use flavors. Only about 16% used classic tobacco. So this really shows the prominence of flavors in their switching journey. So next, I'm going to shift to a heated tobacco product. So this is data for the Plume heated tobacco product system. Altria is partnering with JTI to bring this product to the US through the PMTA process. And so Plume is a heated system that's available in 4 different stick varieties, 2 that are tobacco variants, and 2 that are menthol varieties. And for the purposes of the PMTA, we conducted a 6-week actual use study. This was among adults who smoke, and we evaluated the behaviors at the end of the study. What we saw was similar. So while we saw very strong switching rates across, those who used menthol had significantly higher switching rates than those who used tobacco exclusively. I'm going to shift the data one more time, just like we did last, to focus just on the switchers. When we look at those who switched at the end of the 6-week study, what we see is that, again, the majority used menthol either exclusively or in combination with tobacco. All right, my last data set is going to be a little bit different. And so this is data for the On nicotine pouches. So On comes in a variety of flavors. What we did here was a randomized study where participants were either randomized to use only the original variety, or they could use original and all of the flavor varieties. And so participants were adults who smoke, and what we saw, I'm going to share data that's a little bit different here. This is the proportion of participants with smoke-free days over each of the 6 weeks. What's interesting is at the beginning of the study, you see flavor outperform original, but by the end of the study, they start to converge. I also share liking data. Now, this is data among the gray are those who received the original variety. And as you can see, those who received flavor preferred. They liked the flavors more so than the original. So this is important because it has real-world implications. If you think about a consumer going to the store and purchasing original, let's say that's all they're able to access, would they stick with purchasing a product that they kind of like, and they don't actually see any benefit until maybe 3 weeks? it definitely raises the question against prohibition. So I've shared with you different studies, different products, and how flavors can play a role in switching. But let's shift to the other side of the story. And to do that, I'm going to go back in history, so please just bear with me a moment. Okay, so this is data, and it's specific to cigarettes. And this is from the National Survey on Drug Use and Health among 12 to 17-year-olds in the United States. And what we saw was from 2002 to 2010, the overall trend of cigarette prevalence was going down. But the FDA made the comment in the quotes, which is that, you know what, we're seeing a different trend for, or rate of decline, I should say, for those who use non-menthol versus those who use menthol. In fact, that menthol trend isn't declining at the same rate. And so therefore, we think that menthol cigarette use among youth is actually leading to progression in cigarette smoking. So there was this heightened focus on menthol. So what happened next? Was menthol banned in the US? Did youth smoking rates go up? No, you all are well aware of this. Fortunately, we have seen underage cigarette prevalence continue to decline across both non-menthol and menthol cigarettes. This is older data, but it continues to kind of paint the picture of, hey, you know what? You can still have prevalence come down without prohibition. So now I want to shift to data in the non-combustible space. So this is data from the National Youth Tobacco Survey. Again, it's among middle school and high school students. The black line represents those who use any tobacco product, blue is e-vapor, and then red again is cigarettes. So we see a similar trend with cigarettes. Many of you all are familiar that in 2019, we saw a peak in underage use of e-vapor at about 20%. And at that time, the majority of those underage reported using a flavored e-cigarette type, so close to 70%. Now you can see the trend line. What's happened? It's gone down. Prevalence has declined to below what it was in even 2014. So what does it look like now? Actually, more of those underage are reporting using flavors. But we have to look at the big picture. Prevalence can in fact go down despite flavors being in the market. So I've shared with you data from kind of both sides of the coin, so those who are smokers and the value that these flavors can play for them, as well as the prevalence of underage use going down despite flavors being in the market. So in conclusion, we believe that really a consumer-centric approach makes sense. Availability and choice of flavors in the marketplace can help accelerate harm reduction while also minimizing those unintended consequences. And with that, I have colleagues who helped me get here, and I very much appreciate their support. And I think I'm handing it over to Chris. Thank you.
Thank you, Elizabeth. I don't thank Ian for putting me after Elizabeth. Elizabeth is a blockbuster movie, and now you're going to hear from the guy who comes in at the end of the movie to sweep up the popcorn. Let's see if I am tall enough. So I'm going to talk about the strength of the evidence supporting the continued marketing of non-tobacco flavoured ends products specifically. Just a quick disclosure about myself. My company has received funding from manufacturers of tobacco nicotine products to conduct perception and behavioural studies on their behalf for submissions to regulators, primarily in the US for PMTAs and MRTPAs. Just to start, I was reminded by Facebook that I was here 9 years ago. I've actually been here, I think, every year, apart from the COVID years. But this popped up on my Facebook today. I thought that was quite interesting. It looks like it's the same room as well. So I'm going to quickly go through or touch upon the evidence pertaining to one specific question. Do people who use non-tobacco flavoured ends flavours have a higher likelihood of quitting smoking than people who use tobacco flavoured ends? And how strong is the evidence for that hypothesis? Now, many in this room, through your personal use of the products, may attest to the fact that non-tobacco flavoured ENDS products have helped you. You may know 3, 4, 5 people each who have also benefited from the use of ENDS in non-tobacco flavours. And you may argue that to such an extent that removing retail access to those non-tobacco flavoured products would diminish interest among those who currently smoke from ever trying vaping products. And you may also argue that people who currently have already successfully completely switched from smoking to vaping may be tempted or incentivized to go back to smoking cigarettes if their preferred non-tobacco flavoured ENDS were no longer available. And all this would lead to a general conclusion that preserving access to a diverse marketplace of non-tobacco and non-menthol ENDS flavours can help to complement conventional tobacco control policies and interventions to accelerate reductions in adult smoking prevalence and associated health consequences. But there are people who disagree, and the opposing view is that actually no, non-tobacco flavoured ENDS products are not necessary. As an example of this view, an editorial published in the New England Journal of Medicine in 2019 argued that FDA should simply ban the sale of flavoured nicotine products for use in e-cigarettes, and the reason for arguing for this is that the authors argue that the public health problem that e-cigarettes were intended to solve, that is helping users of combustible tobacco products to stop by switching to vaping, is adequately addressed by liquids that are not flavoured to appeal to adolescents, so essentially flavoured vape products. And so the argument was that we believe, the authors believe, that tobacco flavoured ENDS products can help smokers just as well as non-tobacco flavoured products. And this position has been taken up by many in tobacco control and people who are opposed to vaping or sceptical of vaping and its contribution to population health. And subsequently, the onus has been put back on manufacturers, industry, to demonstrate that the marketing of ENDS and non-tobacco flavours provides the smoker population with an added benefit over and above that delivered by tobacco flavoured ENDS. So what then has been the evidence on the role of non-tobacco, non-menthol flavours in smoking cessation? What's the quality of this evidence? And most importantly, do we have sufficient high quality evidence to draw reliable conclusions? So to answer these questions, we must first be clear about what qualifies as high quality evidence, what constitutes high quality evidence when it comes to policy and regulatory decision making. This is the hierarchy of evidence pyramid, which you may be familiar with. The pyramidal shape qualitatively describes the amount of evidence that's generally available from each type of study design and the strength of evidence that's generated by each study design. And as we go up the levels of the pyramid, the amount of available evidence typically declines, but the quality of that evidence increases and the risk of bias reduces. And additionally, as we go up the pyramid, we gain confidence in drawing conclusions about causal relationships between an exposure and an outcome. The healthcare policy and regulatory decision making is ideally determined by evidence that's available towards the top end of the pyramid. Now, with respect to e-cigarettes, the most robust evidence of the efficacy of e-cigarettes for smoking cessation comes from the Cochrane Review Group's systematic reviews. The CRG's systematic reviews of e-cigarettes, which have long been supported by Cancer Research UK, exist to provide healthcare professionals and policymakers, primarily in the UK but also internationally, with the best available evidence upon which to base their advice and recommendations to people who want to stop smoking. In 2023, the CRG published a systematic review of 319 randomised controlled trials incorporating over 157,000 participants, and the authors concluded that on the basis of that available evidence, there's high certainty evidence that nicotine-containing e-cigarettes, varenicline, and cytosine are the most effective options that are currently available for helping smokers to quit long term, which they define as no smoking for at least 6 months. And specifically, the review found that for around every 100 people who are trying to quit, around 14 are likely to succeed in quitting by using a nicotine-containing e-cigarette, varenicline, or cytosine, which is a better rate of efficacy compared to other available options. So what then, having found that there is strong, high-quality evidence demonstrating the efficacy of e-cigarettes in general for smoking cessation, what then have Cochrane systematic reviews found about the role of non-tobacco, non-menthol flavours in smoking cessation? And to anyone who's familiar with this, the answer is not good. There have been 3 systematic reviews of ENDS flavour use studies published in the past 3 years, 2 from the Cochrane Review Group. This first one from 2022 found that there was only one study that directly compared different flavours between randomised groups, and given that lack of evidence, there is essentially then no clear evidence that e-liquid flavours affect smoking or vaping outcomes at 6 months or longer. But this, I emphasise, is not due to evidence of the absence of an effect, but rather to do with an absence of high-quality evidence. So as of 2022, with the available randomised control trials that were published at that point in time, there was no clear evidence that non-tobacco flavours did provide an added benefit over and above tobacco-flavoured products. The update review in 2025 reaffirmed that conclusion, finding again no clear evidence was emerging that e-cigarette flavour was moderating smoking abstinence outcomes at 6 months or longer. And based on the available intervention studies, there's no clear association between the use of e-cigarette flavours and smoking cessation, again, due to a paucity of data. Again, only one study had randomised participants to use either a tobacco-only flavoured ENDS versus a choice of e-liquid flavours. And the authors conclude, therefore, that to more reliably conclude upon this question, more RCTs should be carried out in which participants are randomised to different flavour conditions because, in the author's words, this is the only study design that can be used to establish causality, a causal relation between flavour use and smoking cessation. And just to go a little 2 years back in time, a systematic review by Alex Lieber and colleagues found essentially arrived at the same conclusion, that from their review of 29 cross-sectional and longitudinal studies, that the evidence on the role of different flavoured ENDS use in smoking cessation at that point in time was inconclusive. But again, this was not due to evidence of no effect, but rather the insufficient quality of the studies that were available at that time, reflecting highly heterogeneous study definitions and various methodological limitations. And Lieber and colleagues reiterate the conclusion from the CRG. One method to address this dearth of convincing evidence would be to randomly assign ENDS flavours to study participants. More high-quality evidence, ideally from randomised control trials, is required. So the type of randomised control trial that the authors of these systematic reviews are pointing towards, calling for more of, would look something like this. An eligible sample recruited from the general population, randomised to use, in this example, either a tobacco-flavoured ENDS, a menthol-flavoured ENDS, a fruit 1, fruit 2, or fruit 3, let's call it mango, strawberry, or pineapple. And those participants randomised to those conditions would have access to and be encouraged or required to use only the assigned flavour for a minimum duration, ideally 6 months. And this is the proposed rough design that researchers are calling for more of to deliver more convincing evidence. I would argue, however, that RCTs are not the best context for assessing the effects or the efficacy of ENDS or ENDS flavours for smoking cessation, and that would apply to any consumer product. The RCT design is long established as the best method for evaluating health outcomes, changes in health, resulting from use of a specific drug according to a tightly controlled schedule of conditions in a homogeneous group of people. The high degree of control over the characteristics of study participants, the random assignment to conditions, and instructions on how and when to use a drug, make an RCT an extremely useful design for isolating the effects of controlled use of a drug. However, I would argue that these same features make RCTs likely to be of less or limited use for yielding valuable information about the drivers of natural adoption and actual use of consumer products, ENDS in particular, and how these products are used in everyday life under real-world market conditions. For example, randomized controlled trials of ENDS flavours would likely be unable to capture the characteristics of natural adopters of ENDS products, their reasons and motivations for trialling a product and progressing to regular use. It would be unable to capture the effect of real-world market and social influences on tobacco use behaviour, so price, retail availability, media coverage, social attitudes. And importantly, it would not be able to capture how individuals' initial flavour preferences and use patterns change over time, as Elizabeth mentioned in relation to their study, the Altria study. That is that RCTs don't capture the individual's continuous process of curiosity and discovery and adjustment to find out what satisfies them, what works for them. And as Elizabeth mentioned, there are people who, if given a product, a flavour to use, then they may use it because they're given it. But in the real world, it's likely that a high proportion of people would use that thing, but then probably give up on it once, go and experiment with something else, and find something else that they liked and never return to the flavour that we would give them as part of a trial. It's also important to emphasise that ENDS users are heterogeneous. Their reasons for using ENDS are varied. The experiences that they're seeking from using an ENDS are varied. And most importantly, really most importantly, most people who use ENDS products don't use those products in the narrow, stable ways that may be required of participants in an RCT. RCTs will typically constrain the factors that we know are important to switching, such as having access to a variety of flavours, the freedom to choose from among those flavours, and as I mentioned, the evolving preferences and journey of discovery that many vapers tell us about. But in order to isolate the effect of a specific ENDS flavour, RCTs would typically be designed to eliminate or constrain participants' flavour access and their choice so as to minimise the variation in flavour use, therefore pulling the findings away from what would happen in the real world. And yes, so this constraint, this restriction has the effect of inhibiting the heterogeneity, the natural heterogeneity among ENDS users and the evolution of ENDS use preferences that are common in the real world. And the randomisation process also means that, as I've just mentioned, many participants would be assigned to use flavours they wouldn't naturally choose to use in the real world, and therefore the switching or cigarette abstinence outcomes that are observed in an RCT may substantially underestimate the outcomes that we may see in the real world. So just to summarise this last bit, the RCT is undoubtedly the design that will yield the strongest evidence of the comparative efficacy of a flavoured ENDS product versus a tobacco-flavoured ENDS product for quitting smoking under tightly controlled conditions, but people in the real world don't live under tightly controlled conditions. Participants of RCTs of ENDS are therefore unlikely to resemble the population who will naturally trial and use ENDS flavours in the real world. And to the extent that trial conditions constrain individual choice and use of products and the patterns of use, of a flavoured ENDS observed in an RCT may have quite limited generalisability for describing how real-world users will actually use ENDS flavours in their everyday lives. And relatedly, to the extent that trial conditions differ from real-world market conditions, and they often very much do, then the impact of a flavoured ENDS product on cigarette smoking among trial participants may have limited utility for predicting levels of smoking cessation and reduction that would be observed among real-world users of flavoured products. So a solution to this, regulators, policymakers are seeking the highest quality of evidence, which in the traditional medical paradigm means evidence from a randomized control trial. So how do we give policymakers the types and strength of evidence that they are seeking, but making those trials more closely resemble how these products are used in the real world? This is one suggestion, subject to further refinement, but rather than assigning people to use only a tobacco, only a menthol, only fruit 1, fruit 2, or fruit 3, one approach, which I think now several companies are taking an approach along these lines, is to have a tobacco group which represents a future hypothetical universe in which, let's say, the FDA prohibit retail sale of anything other than tobacco flavour. So this is modelling that or simulating that future regulatory environment. Randomisation to a menthol product, and then randomisation to an arm in which the participants have free choice of all flavours in the portfolio of flavours being tested. Tobacco, menthol, fruit 1, 2, 3. People can use any one they want. They can start using any one they want. They can change at any time, go back to flavours, use 1 flavour, 2 flavours, 3 flavours, etc. The choice is up to them. And from that, we learn what people choose and how those choices relate to efficacy of each individual flavours and of flavour combinations. And what this allows us to say is, screen's disappeared. Okay. It's gone off here. What this allows us to conclude is that is the added benefit of having access to a choice of flavours versus access to a single flavour, which really is no choice at all. So to summarise, where we sit at the moment in the evidence landscape is there is inconclusive evidence that using non-tobacco flavoured flavours increases a person's likelihood of quitting smoking relative to use of tobacco flavoured ends. But this is due to a lack of high quality evidence from RCTs. And one remedy, therefore, to this, we need, because regulators are calling for it, we need to provide regulators with more convincing evidence from RCTs that better enable observation of how people use ENDS flavours in the real world. And this part of that would include having RCTs with arms that compare current versus potential future scenarios of ENDS flavour availability. So right now, the question is, what would adults who smoke do if overnight their preferred non-tobacco flavoured ENDS products were to disappear? Right now, the authors of the New England Journal editorial that I said at the start would say, well, right now there's no evidence that keeping these non-tobacco flavours on the market will provide any added benefit. And that is the challenge that we're all faced with, is demonstrating with appropriate study designs that removing people who smoke access to a variety of non-tobacco flavoured products will hurt them and their families by extension, by disincentivizing people from trying vaping as an alternative to smoking, reducing their motivation for attempting to quit smoking, and ultimately reducing their success in quitting smoking if their preferred flavours are not available to them. But as I say, right now, the evidence landscape is that there's inconclusive evidence that non-tobacco flavours provide that benefit, and it's on us in this room and beyond to provide policymakers and decision makers with higher quality evidence on which to base future regulatory decisions. Thank you very much, and happy to take questions after.
So thank you so much for the two speakers that preceded me. I'm going to give you a look at the flavors from a toxicologist perspective. So Elizabeth and Chris did a great job. Oh, what's happening. Okay. Okay, sorry about that. So Elizabeth and Chris did a great job of talking about their role in examining consumer acceptance and looking at adult smoker appeal for flavored tobacco products. So I work on the other side of the equation, the green circle around scientifically substantiated reduced risk products. So that's what I'm going to be talking about today. And with that in mind, I hope the key points that come across are that health risk assessment is key to supporting the development of flavored products to support global harm reduction, that relative risk to cigarettes is a critical evaluation to conduct, that we should be approaching misperceptions with appropriate risk assessment paradigms, and that we should explore and utilize available tools to improve health risk reduction of flavored products. So when it comes to the potential health risks of flavored products, much of the public encounters headlines like this. We all know that these sorts of headlines can lead to pervasive misperceptions. We've seen this with E-Valley. We've seen this with popcorn lung. Yesterday in one of the workshops, Ariel talked about that there are some in public health that will pinpoint potential toxicological effects of flavored ingredients and use that as a lever to deter youth use of those products with little scientific substantiation. And so this is a real challenge for us, especially as toxicologists. And we need to be able to approach these headlines with extreme caution and follow accepted risk assessment paradigms. So what is the human health risk assessment process? Well, it involves 4 key steps. The first is hazard identification. Then you have dose response assessment, followed by exposure assessment, and lastly, risk characterization. You'll see in those headlines that most of that is just about identifying potential chemicals in the flavored products, and so you're up on that first step of hazard identification. And so what I'm going to show you is how essential the next few steps are going to be when looking at the relative risk of flavored products to cigarettes. So firstly, the health risk assessment process is really essential in flavored product development and is critical in contributing to product stewardship of flavored products. So when thinking about integrating a risk assessment framework, you're going to want to do that early on during product development. And you're going to want to consider guidance to develop consistent frameworks across the different markets that the product is going to be sold in. The risk assessment framework can also be used to select ingredients, to conduct accurate hazard identifications and to select those ingredients, and also to exclude ingredients of the highest toxicological concern. The risk assessment framework can be used to conduct quantitative risk assessments, and these can be considered to look at cumulative cancer risks when formulating the product. So you can look at the overall risk of what the ingredients, what the HPHCs in the aerosol, what leachables, how they're all contributing to the overall risk of the product. You can use literature, predictive tools, or analytical testing to determine potential thermal degradation of reaction products in the aerosol. Chemistry evaluations may include aerosol instability testing of the product to support health risk assessments of the flavored ingredients. And these are also essential to conduct a health risk assessment after such chemistry evaluations. So all of this can contribute to our evaluation of producing a flavored product that smokers can benefit from. Lastly, there's experimental toxicology that can be conducted to investigate the biological significance of these products. There are some limitations in the experimental evidence, experimental toxicology, to support the hazard evaluation and the relative risk, but they can be used in a really effective way to look at the biological significance of these products. And so how do we use this framework to look at the relative health risk assessment? So relative risk to cigarettes and other tobacco products is a critical evaluation, and it's supported by recent FDA correspondence. The final PMTA rule and memoranda emphasize the importance of conducting a cancer risk evaluation and looking at the excess lifetime cancer risk. So this figure here, this pie chart, is essentially showing what FDA's risk management decisions are. So you can see that when they published their memoranda, or it wasn't published, but it was released through a FOIA Act, they demonstrated that ends with marketing granted orders had about 1% the risk of cancer as combustible cigarettes. And you'll see here, according to their risk management decision, that falls within about a low risk compared to combustible cigarettes. We can use the risk assessment process to also quantify non-cancer risk. So here we have some evaluations of respiratory toxicity hazard, cardiovascular toxicity, as well as reproductive and developmental toxicity. And these are also the ends with marketing granted orders. So just as similar with the cancer risk, there are meaningful reductions in levels of HPHCs and target constituents across these products, and also greater than 99% calculated risk for these non-cancer hazards. So the health risk assessment process can be a really valuable tool in looking at relative risk to cigarettes and quantifying that risk for both cancer and non-cancer. What I've shown you now is data from menthol and tobacco flavored ends, but what about other flavors like fruity flavors? So we know that these are of high concern, and most of the headlines, again, are pinpointing different ingredients from these products. Again, we need to approach these headlines with caution and follow accepted risk assessment paradigms. So most of these are really looking at just hazard identification and looking at chemicals that are identified in those products. One way that I like to contextualize the data is to look at the aerosol as a whole. So here we have, in this figure, one of my collaborators, a publication from a couple of years ago, where they looked at non-targeted analysis of the aerosol. So you'll see from this figure that over 99% of the aerosol mass it contains PG, VG, nicotine, benzoic acid, and targeted compounds. Those targeted compounds are HPHCs or other major flavor ingredients. Less than 0.1% of the aerosol mass was what we call either reaction products or other flavorants. So it's a very small percentage of the aerosol mass. So when we look at those headlines and we see sort of that hazard identification, we need to contextualize it and think about the overall exposure and what the potential risk might be to the consumer. Importantly, what's shown here is that there were about only 100 compounds detected in this menthol. This is a Juul e-cigarette. And cigarette smoke has over 5,000 compounds with a high chemical complexity. So the cancer and non-cancer risk reductions are driven by the reduction in targeted compounds, which comprise over 99.9% of the aerosol. And the other reaction products, such as flavorants or products that are not recognized, like not rationalized products, excuse me, are less than 0.1% of the aerosol mass and may contribute a much lower risk. So what about other flavors? What I've shown you is menthol. The aerosol profile is unlikely to differ significantly for other flavored ends, especially if those are developed with a comprehensive product stewardship program and risk assessment framework. And indeed, we have seen a lot of data. We've conducted a lot of risk assessments on flavored products. Much of it is not published, so I haven't shown it here today. But other fruity flavors can demonstrate just as much of a reduced risk potential as menthol and tobacco-flavored products. So what I want people to really take home is that identification of hazards does not equal risk. And reduction in risk for the most potent targeted compounds, which comprise 99.9% of the aerosol mass, is really what's driving that risk reduction to cigarettes. When we think about other flavoring ingredients and potential irritants, there may be a contribution to non-cancer risk of irritation, but the major aldehydes are greatly reduced compared to combustible cigarettes. And so how do we use these tools to improve the risk reduction potential of flavored products? There are many different ways. We can look at improving our hazard identification tools by using in silico predictions or read-across methods. We can understand the heating of our products better. We can use that to investigate predictive models and understanding the chemical kinetics. We can definitely improve our quantitative methods for non-cancer and cancer risk assessment. There's always a little bit of uncertainty around these methods, and those can always be improved. We should also be looking into new approach methodologies to improve the hazard identification of the potential health effects of these products. And then lastly, we can look at different approaches for bridging to innovate new flavored products. And so we've come full circle. Health risk assessment supports the development of flavored products to support global harm reduction. The relative risk to cigarettes is critical. That's what our goal is here. We need to approach these misperceptions that we see in the headlines with appropriate risk assessment paradigms, and we can be using new tools to improve health risk reduction of flavored products. And I have some collaborators I'd like to thank, whose work was shown in this: Dr. Charlene Liu, Dr. Mark Crosswhite, Perla Landestoy, and Richard Young and Charles Johnson.
Yeah, I fall in the group of short ones. Thank you very much to the panelists for providing insight into the scientific considerations, other scientific aspects related to flavors. I would like to add regulatory perspective to the discussion. It's really important topic, polarizing topic. Polarizing and opposite views are often expressed in the public, and those are driving regulatory policies and influencing regulators. And unfortunately, not always this influence is actually going the right direction. Some of those considerations are based on our experience with interacting with Food and Drug Administration, based on products and applications we filed to the agency. PMI has a portfolio of products which are authorized for sale in the States, and these are also flavored products. So we understand the importance of flavors in the portfolio of products. Additional consideration in this talk are coming from observations and analysis of decision-making process of the agency. Maybe let's start with a rhetorical question: if actually regulatory policy can be driven by the science. And I think I call it a rhetorical question because the answer is yes, obviously, it must be driven by the science. So what needs to be done that the science is actually considered in the policy making? Because we've often see, not only in the United States, but also outside, that policies are driven by beliefs, by false statements, and not necessarily supported by scientific evidence. We've heard from previous panelists that flavors are important. What we see actually is ban or restrictions of flavors, which is opposite to what science is saying. So what we should consider? First thing, and Elizabeth already demonstrated this, that adults and young people, they desire flavors. So it's not only young people, but also adults. Where's the problem is the false belief that flavors that adults desire are different from those that are desired by youth. And actually, regulators tend to put flavors for adults. They consider mostly tobacco and menthol. Anything else is youth appealing, it's a youth flavor. And even if when driving the developing policies, this is the driving force into defining what is actually or could be used by adults and what should be banned in tobacco products. Reality is that actually flavors that are liked by adults almost are identical with the flavors liked by youth. So there is a problem. Tobacco harm reduction it's all about successful transition from combustible cigarettes to better alternatives. We need flavors then to facilitate this switch. And we cannot base the policy on assumption that blueberry is just youth appealing flavor. Adults like blueberry flavor. So this needs to be considered in the policy making. Another element often seen in the policy, and also I'm glad I saw it as well in Elizabeth's presentation given by Elizabeth, is that there's this belief that actually youth uptake of tobacco products is correlated with availability of flavored products. And the flavors are actually promoting the youth uptake. And again, when looking at the NYTS data, it can be clearly demonstrated that there is no correlation. We've seen from Ian a photograph from a shelf in the US. This is the reality. There are many products which are flavored products which are widely available. When you look at the NYTS data, you actually can see that the vaping prevalence, youth vaping prevalence, is actually not correlated to the sales of vaping products, to the volume. Why is that? It's not because of regulatory actions. It's not because FDA authorized only few tobacco-flavored cigarettes and only even fewer menthol-flavored electronic cigarettes. This has nothing to do because flavored products are on the market and they are widely available. When you think about the time point when actually this correlation is now, the difference is so prominent, you can see that you can associate this with other practices that were put in place. It was the educational campaigns, and I would also say more responsible marketing campaigns by tobacco companies. So all these actually, in my opinion, contribute to this change of the trend, rather than actually banning flavors from use in vaping products. So another argument that should be considered in policy making, banning is not always a solution. Maybe educational campaigns, maybe stricter post-market surveillance requirements. These are additional elements that can actually prevent youth from unintended use of tobacco products. I would like as well to present a case study which actually reflects current approach of the agency in the decision-making, agency meaning Food and Drug Administration, in the decision-making. So in application combining 3-flavored product and tobacco-flavored product, FDA would authorize flavor 1 and 2 because those flavors, through the scientific data, are proving that actually the conversion power of flavor 1 and flavor 2 is greater than tobacco-flavored product. However, flavor number 3 would be rejected. Flavor number 3 would be rejected because its converting power is actually inferior to flavor 1 and flavor 2, and it's also inferior to tobacco-flavored product. So assumption would be, this is nice to have, but it's actually not contributing a lot to the overall switching of smokers. And we ask the agency, we ask regulators to look at the data. So one could claim this is a scientific data. It's proven through the study. but we ask as well, we should be asking as well, not only look to the numbers, but to have a deeper look into what is behind those numbers. When you analyze actually a real situation and you will see what is behind the numbers, it can happen that actually flavor 1 and flavor 2 is liked by the same group of smokers. So actually, by authorizing flavor 1 and flavor 2, we would only address a small group or a subpopulation of smokers. By rejecting flavor 3, we are actually missing opportunity to activate yet another subgroup of smokers who would probably switch if the flavor 3 was authorized. So it's not only numbers, but also the analysis of what is behind the numbers. And this should be considered in the policy making. This would be the example of public health-driven authorization. So I tried not to be too long with the slides. I think it's good summary would be flavors are needed in tobacco products, and we should not be basing our decisions on misconception that flavors are only for youth and they are actually facilitate abuse of tobacco products. Adults as well desire flavors. We need to base the decision-making process, so regulatory policies should be based on the scientific facts. And scientific facts should be well analyzed, not only data, or what is behind the data as well. We should also be looking into the real situation on the market, what's going on when drawing the conclusions. And actually, again, I think this confirms the need for the well-defined studies, well-defined risk assessment consideration, what's in the product, and analysis, who is using the product and why is using the product. And with this, I believe we can have really successful regulatory policies implemented, not only in the United States, but also outside the United States. Thank you.
Can I get this? Oh, it's working now, thank you. Thank you so much for those invaluable insights, I think, into a diverse range of topics which get at this issue of flavors. So now we want to open it up for questions. There's a lady there with a green dress. Is there a microphone, or do you want me to walk around? I can bring this one.
Thank you. Such a wonderful presentation. I'm Carolyn Beaumont, General Practitioner from Australia. I have two questions I'm going to be cheekily asking. One is for Autumn. So in my work, I've helped probably about 4,000 adult ex-smokers get their vaping script in Australia because I need it. And many have said that, the nice, high-quality regulated vapes, they're great, they don't make them cough, but when they sometimes are forced, because they can't access that, to go back to the illicit vapes, they cough a lot. Any toxicology sort of thoughts on that? Why the illicit vapes are making people cough a lot more? What sort of irritants are happening?
Is this on? Oh, great. That's a great question, and it's so nice to get your insight as a medical doctor and hear what you're seeing actually in the clinic with real people. There could be a lot of reasons for that, but there really could just be more. It could have to do with the device itself. So the device itself could be emitting more metals with the heating. There could be different ingredients that are in fact irritants that are at higher levels that are exceeding that threshold that we would like to see for toxicological concern. So yeah, they're basically, when you have these illicit vapes, they're not going to be, conducting the appropriate product stewardship practices, and so they won't be minimizing the risk as much as they can do. So, but yeah, it could be anything from the product formulation to the actual device itself. So, but that's really interesting to hear.
Yeah, thank you. And if I may, just one for the general panel. The other one is on the use of tobacco-flavoured ends. So something I've noticed with many of my patients, customers, clients, sides, whatever you want to call them, is that they'll initially switch from smoking and they'll start a tobacco ends and very, very successful, but they'll find after 2 weeks, maybe up to 2 months, when their taste and smell returns because they've stopped smoking, they realise how horrible tobacco flavour actually is. So from that, they'll then go on to other flavours, usually sort of mint menthol or a fruit flavour. I just wondered, is there some data that supports my clinical experiences there about the return of taste and smell that then drives the change from tobacco ends to other flavours?
I'm happy to jump in a little bit here. So it's a really good question, and I can see you around the corner. So I'll actually start with some qualitative data that we've seen, which is that as smokers decide to transition to non-combustible products, they want a different experience. So they want to kind of distance themselves from tobacco flavors, and that's often a reason for choosing the flavored products. But that said, we are seeing some where anecdotally, and there may be firmer evidence that I haven't dug into, that some of the benefits of taste and things like that do return within a certain point of time, and a different flavor is desired. So,
Just a further comment on that. What you're describing there and the people who say that to you is quite representative of what studies show about smokers will predominantly, although less so now, as time goes forward, be initiating vaping with a tobacco-flavoured vape because it's the shorter bridge from cigarettes. But experimentation then happens, and fairly quickly people move away from tobacco-flavoured vapes. And just to reiterate the point I was making, that type of evolution of preference and process of discovery gets beaten out of participants in randomized controlled trials, and we don't get to discover how people change over time. And actually, Elizabeth's studies where people are given choice to take flavors or leave them or go back and forth are much better context for showing us the time course of change and how preferences change over time.
Can I only add to this? I would like to encourage you to publish this data or think about publicizing this data, because I think it's a very important point in the discussion. It's something new, not necessarily seen in the public domain, and I think it's important aspect, especially for the regulators, especially in Australia. So. Yes, please be vocal about it, because it's also another argument why flavors are needed, why they shouldn't be banned.
Unfortunately, as a doctor in Australia, I'm so hampered and limited by what I'm allowed to say by the Therapeutic Goods Association. There's very little I can safely publicly say, which may in any way, shape or form support at all. My medical license is at risk. It's tragic, absolutely tragic. I just can't get the message out there.
Just an observation, get Christopher's opinion on this. I hadn't been aware of that, the difference. There isn't, on the available evidence we have, a difference in outcomes between whether it's tobacco flavour or other flavours. But it did have me thinking, we all know how this is going to be picked up by the ants side, which is, well, why do we need flavours if there's no difference in the outcomes? That's going to be a bit of a problem for us, and that's not what it's saying. It doesn't say anything about how many people use flavours and how many people are attracted to electronic cigarettes because of flavours, which is extensive. I don't know exactly what the figures are, but certainly well over 80% of people that use probably electronic cigarettes would use flavours and would cite flavours as very important. But that is going to be a little bit of it's going to be used probably against electronic cigarettes.
Yeah, absolutely. And so to be clear, there's not evidence of no difference. It's just an absence of evidence showing differences one way or the other. And yeah, my opinion on this is that the studies that Elizabeth described, observational studies where real-world consumers who purchase products of their own volition with their own money and either keep using them or stop using them or change using them, that's the type of data that better informs the value the added value of non-tobacco flavoured ends, because these are consumer products. They're not medicines. Medicines are designed to be tolerated. They're not designed to be enjoyable. Vape products are designed to be enjoyable, so people go where the pleasure is, and it takes them a while to find where the pleasure is, but once they find it, they'll stick with it and have better outcomes because they've found something that works for them. And I just think that the traditional trial design of telling a person, you use this, you use that, and you use something else, is going to tell us something. It's going to tell us what would happen in a world where the FDA takes away all flavours and they're left with only tobacco. It will help to answer that question, but it doesn't tell us much about the world we currently live in, where people have the choice of 10, 20 flavours at their local store. They have the choice of vapes, pouches, heated tobacco products. And so, yes, I was concerned in putting the presentation together to say what I wanted to say and not let it be interpreted as there is no evidence, this means we don't need flavours. I absolutely believe we do need flavours. I just think regulators and industry need to find a common ground where we agree on the best way of demonstrating this for a consumer product that's not meant to function like a medicine, be used like a medicine. Take it twice a day, this dose. It's not that. So the utility of applying that medical paradigm to this recreational consumer product makes little sense to me. But I think we need to keep discussing with regulators to emphasise the importance of longitudinal observational data as the more informative type of data.
Hi, hello. Thank you very much for the panels and the presentations. I think we all agree that flavors are important and are there and have to play a role. And you just mentioned now that how do we find that middle ground from a policy-making perspective? I haven't seen many data, but what do you think, like, conceptually, and then maybe explore? Because at the end of the day, from a consumer perspective, there are two main things, right? Flavors and nicotine strength. So what you would think if you play inversely? So the highest nicotine strength, the lower flavor availability, or the lower nicotine, you compensate with more flavors. I don't know, for example, in the European context, any product above 10 milligrams, just tobacco menthol, below 10 milligrams, you can play with a wider range of flavor. What do you think, like, from a policy design perspective?
Again, policy should be driven by the science. And we know that above certain concentrations, like certain content of nicotine in electronic cigarettes, it's very difficult to use the product. The sensory element, the nicotine kick, is just too much. And only small group of smokers is actually willing to use really high concentrations of nicotine. And also, I think it's really complexifies the whole deliberation. We haven't yet reached any consensus with the current situation about what to do with flavors, considering available strengths of nicotine. Maybe we should do it step by step, because the concept is nice, but the concept would need to be justified with data, with scientific evidence. Generating this scientific evidence will take time. And also the question is how we defined what is the lower strength and higher content of flavors, what is the higher strength of nicotine and lower content of flavors. Again, we would probably spend years discussing that with concentration for, I don't know, 1 milligram, it's no flavor. Above 10 milligram, certain flavors are allowed, and also why you would like to only have like one cut of. Maybe you should have like staggered approach, 3 or 4 different concentrations with 3 or 4 different differences in flavors. Like menthol, it's after one threshold, fruity flavors after the other threshold. I think it's endless. It's interesting point for the discussion, but I don't think that in the current environment, regulators are ready to have these discussions.
Yeah, I'll just jump in. Similar to Pioch, I would argue we have to follow the evidence. And I can speak to a little bit of data that we have on the on product. So we conducted a different study that included all varieties. So it was 7 flavors, or original and 6 flavors, and then I guess 5 different nicotine strengths. And so in the study, it was an actual use study over 6 weeks. We included adults who smoke as well as those who use dip, or moist smokeless tobacco. We saw that participants came in and used about 3 to 4 products and then kind of narrowed it down to 2 products that they preferred by week 6. It ranged the entire portfolio of products. There were individuals who used 2 milligrams. There were individuals who used 8 milligram products, and across the different varieties of flavors. So I think to one of the figures that was shared by Pioch is when you look at it, you almost have to do a little bit of like a turf analysis to capture the greatest number of switchers. What are the products that you need to have available? The other angle that I would offer that's going to be focused on by regulators is the abuse liability of the product. So we need to evaluate that against cigarettes or whatever their incoming product use is.
Can I just jump in there and add a little bit of a risk assessment perspective too? So it's something I've been thinking about a lot because of the recent memoranda released by FDA and how they would like to look at cancer risk and normalize it to nicotine uptake, and just knowing that smokers tend to self-titrate when they switch to an ENDS. And when we look at risk and relative risk, we're basically normalizing to the amount of nicotine that would be in like a pack of cigarettes. And so if we have a really low nicotine product, the levels of an ingredient might look really, really high, and the acceptable intake might not look great on a risk assessment. And so there needs to be, I think, some more discussion in the toxicological community and the risk assessment community to make sure that we're not overestimating risks for those folks that like to use the lower nicotine content but maybe aren't consuming so much a day. So yeah, there needs to be like discussion across the clinical and the non-clinical for that.
Yeah, hi. This is Mohammadi from Altria. Great presentation and very timely topic given the debate that's going on in flavors. Chris, I would push back on your comment about RCTs simply because with FDA, the good thing about in the US, FDA's thinking evolves as more evidence starts coming in. So recently, FDA has been willing to consider not only just RCTs, but also longitudinal studies. So I think that the RCT does not give you the full picture of the availability of choice. And I hear your point about finding the middle ground, and that's always beneficial, right? But that middle ground, if it does not reflect a real world situation, and you made a pretty compelling case in your introduction, some of the challenges of RCTs. So I would caution about relying on RCT just to make the case that flavors are important. There is a lot of real world evidence. Elizabeth showed some really nice, compelling data from our adult tobacco consumer tracking study, which clearly demonstrates, as well as the PATH study demonstrates, that flavors are really important.
Yeah, and if it wasn't crystal clear, let me try and be crystal clear now. I give more weight to the data that come from longitudinal observational studies of ENDS products than I do to RCT data, because I think RCTs conceal more than they reveal about how people use ENDS products. My reason for raising this is the RCT is what regulators globally, that's the standard or the strength of evidence they're seeking. They're the ones who give more weight to the data from RCTs than from cohort studies, because they think of these products as other medicines or in the medical framework. I don't. I'm arguing for a movement away from RCTs or towards RCTs that have arms that allow or enable direct observation of actual real-world behaviours. So I didn't mean to say that RCT, we should all be out there doing RCTs and giving up longitudinal studies. Not at all, because that's not what I do, it's not what I believe. I believe that the best evidence of how people use consumer products comes from non-interventional studies, letting people live their lives and seeing what they do and trying to be as least intrusive in their life as possible to measure what they do and when they do it. But I'm all about trying to give the regulator what they're asking for, and if we can find a way of making RCTs more resemble how people use products in the real world, some sort of integration of it, a design that retains randomization, but also then enables that observation in at least one of the arms, I think might be a nice middle ground.
I just have one comment. You know, the reason why flavors are getting so much attention is probably because there's such a wide variety of flavors. Do we really need, you know, flavors that are representing kids' cereals, Captain Crunch in the US, or, you know, Bloody Unicorn, or whatever those, you know, names people are using, and maybe just limiting the number of flavors that adults are using and not necessarily attracting kids would be one way to overcome this issue.
Yeah, I absolutely agree with that. Proponents of flavors, just to be devil's advocate, I would say, well, how many flavors are needed to adequately solve the problem? At what point do we have a diminishing level of return? So is it 10 flavors, 20 flavors, 100? Surely we don't need 1,000. Okay, so which are the 900 to go? How do we determine that? And I think, again, FDA or other regulators would look at this and say, what do we lose when we get rid of flavor X, flavor Y? We're only going to lose 0.1%, 0.2%. Okay, they can go. And it's up to industry and others to demonstrate that, whether it's watermelon, blueberry, or cherry, or so on, that there's some flavors that make meaningful contributions to switching and cigarette abstinence, and those, you know, are being defended with data. But I think it's reasonable to conclude that there are probably hundreds, if not thousands, of data in there, flavors out there that don't have data and likely won't have data to defend their continued marketing.
Just have one more question, and then we'll wrap up.
Okay, I'm going to make this quick. My name is Mark Tyndall. One observation with your randomization is that there's some default that people would want tobacco, menthol, or flavors, and we know that 85 or 90% of people are buying flavors, so it seems like it's an odd default that you'd randomize people to tobacco when we know that most people don't even want tobacco. But just, obviously this is a really important topic, this flavors, but we're really arguing on two sides. One is we're trying to discourage people from vaping, and that's youth, and then we're trying to encourage people to vape, and if we put 50-50, then we're into this, you know, this flavor argument, but it should be 90% of our efforts should be to get people off combustible cigarettes, and there wouldn't be any argument. People can use whatever they want, and the toxicology thing that is really important, that the flavors doesn't really matter to the toxicology, it's really just what people want. And if the youth was taken out of that equation, then people could have any flavor they want. Who cares? And it's unfortunate that we're backed into this corner where the emphasis is trying to make sure that kids might not like these flavors. So just a broad comment, but I think we want to get people off tobacco and combustible tobacco, and who cares what flavor they like?
Two very quick points, and over time. My final point on this is that an RCT is undoubtedly the best design for answering the question, what would happen if we banned all flavors? Because we have people only using tobacco and we have people using a choice. So FDA wants to know, what would we lose if we got rid of all the flavors and we leave people only with a tobacco option? An RCT is undoubtedly the strongest design for answering that question, but it's the least helpful design for answering other questions about the current marketplace. What flavors do people choose exclusively in dual use, poly use, etc., in the current environment, and how are they benefiting from that current landscape? And the final point about, I'm sure there are some flavors that don't help switching. I'm sure there are some flavors that just add to nicotine and nicotine use and don't help people reduce cigarette consumption. I completely agree that we should keep our eye on the prize here, which is reducing the number of people who smoke. But I just want smoke-free alternatives to be available that demonstrably do that.
We're going to wrap up there. I just want to do a couple of things. First, to thank the panelists, Elizabeth, Christopher, Autumn, and Piotr, for their valuable insights, and just to thank you all for attending. And we are going to still be here for the rest of the conference. If anybody does have any further questions, come and have a chat with us. And enjoy the rest of your day. Thank you.